Hi guys, welcome to my YouTube channel. If you're watching this video for the first time, subscribe my channel so that whenever I upload any new video, you will get immediate notification and hit the bell icon. Okay. So today we are going to learn about this COVID-19 coronavirus, and yesterday WHO has announced that this virus is very difficult to eliminate. So it's going to stay with us for a long time, and we have to learn to live with this virus just like we are living with the other virus in the community like HIV virus. So if you want to live with this virus, we have to learn about this virus, right? We have to study about this virus. What is this virus and what it causes and how we can stay safe, right? So I decided to make a video on this topic. So this video is based on the WHO guidelines, so you can rely on it. And I have made it in Tamil language also. So if you're comfortable with Tamil language, you can read those videos also, okay? So I have shared the link in the description. So first, COVID-19. COVID-19 is a respiratory virus which spreads primarily through droplets generated when an infected person cough or sneeze, or through droplets of saliva or discharge from the nose. So if an affected person, he cough or sneeze, he will release some droplets, right, or saliva. So if a person passing nearby, if he inhale these droplets, then this virus will enter into the another person's body and cause disease, coronavirus disease. Okay, so this virus is from a large family of virus that can cause common cold to more severe disease. It can cause more severe disease such as MERS. MERS is a Middle East Respiratory Syndrome reported in KSA in 2012. And from there it traveled across to like 27 countries including USA. And 2002 it caused SARS disease, severe acute respiratory syndrome, reported in China in 2002. And now COVID-19 coronavirus disease reported in Wuhan city is a very dangerous disease when compared to SARS and MERS, because this virus can kill a person. It can cause pneumonia and can kill a person. Okay, so this is very dangerous disease. Okay, how to test coronavirus patient? How we are testing the coronavirus patient? So it's various different tests are conducted to test the person who is having coronavirus disease. The one is blood test, using rapid kits, and using sputum test. Sputum test means like they will collect some sample using sputum is a thick mucus. It is generated in your lungs or in your throat when it comes out when you cough. Okay, so they will collect this sputum and then they will check for coronavirus. And what are the symptoms caused by this disease? This disease can cause you cough, dry cough, sore throat, headache, body pain. These are mild symptoms, and it can cause severe symptoms like chest pain, difficulty to breathe, and you will feel very difficult to breathe because it's going to directly affect your lungs. So you will feel very difficult to breathe. So these are the symptoms of this virus. Okay, so next, preventive methods. How to prevent from this virus? See, we don't have any other choices because there is no medicine or vaccine to treat this disease. So we have to prevent this virus by following proper personal hygienic procedures. These hygienic procedures means clean your hand with sanitizers or soap properly, and wear dust mask, cover your nose, mouth, and you safely store your used and unused clothes separately. Don't mix your used and unused clothes. Wash your hands regularly. If you have any of above symptoms, then isolate yourself. This isolation is the best method because you will not spread it to other person. So if you have any of the above symptoms like headache, sore throat, dry cough, isolate yourself. And if you have any severe symptoms, immediately go to the hospital and get the treatment. Okay, so don't wait, because these mild symptoms are okay. You can stay for some times and you can check whether you because if you have the self immunity, you can overcome this virus. Okay, so if you are facing any severe symptoms like chest pain, difficulties in breathing, then immediately contact your medical team. Okay, next one. So I will answer some questions related to this disease. Okay, so first one, How dangerous is the coronavirus disease? This coronavirus disease is a very, very dangerous disease because it can affect your brain, it can affect your eyes, it can affect your nose, it can affect your lungs, kidney, liver, intestine. Okay, it can affect most of the parts of your body. So it's very, very dangerous disease. It can affect your brain, eyes, nose, lungs, kidney, liver, intestine, heart, everything. Okay, so it's very, 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 very dangerous disease and it can kill a person. Okay, so the second question is, can the coronavirus disease spread through food? Yes, it can spread through food because it can survive in different temperatures, right? So wash your food, like if you are purchasing any vegetables, fruits, wash it thoroughly and then use it. Okay. Third question, can coronavirus spread through mosquito bite? No, it cannot spread through mosquito bite. Up to now, there is no evidence that mosquito bites can transmit this disease. Okay. And next one, can the coronavirus disease be transmitted in hot or humid climate? Yes, it can be transmitted in every climate. Okay, it can transmitted in hot or humid or any climate can transmit. So it can spread in every climate, right? Hot climate or humid climate or in even cold weather it can spread. And next one, are smokers more prone to getting the coronavirus disease? Yes, smokers are more prone to get the coronavirus disease because because if you are a regular smoker, your immunity system may be weak, and if you are using cigarettes, you will put it in your mouth, and if there is any contaminated droplets, any droplets over the cigarette, it will directly enter into your body. So they are more prone to get this disease. So better avoid smoking. And next one, can you contract the coronavirus disease by touching a surface? Yes, of course, you will contract the coronavirus disease by touching a surface because these droplets on the surface can stay for a long time. There is no evidence that this can stay for a certain period to conclude that it can stay only for a certain period of time. No, there is no evidence. It can stay up to maybe 10 or 12 depending upon the temperature, and it can stay up to 14 days or 20 days. There is no conclusion. Okay. So next one, can you contract the coronavirus? Can babies get the coronavirus? Yes, babies get the coronavirus disease and they are already affected by the coronavirus disease. We have seen some cases. And how long does coronavirus stay on the surfaces? It can stay for a long time, but there is no proper conclusion or proper evidence to conclude that this virus can stay only for a certain period of time. There is no proper conclusion or evidence as per WHO guidelines. Okay. So next one, what is the recovery time for the coronavirus disease? It may take 2 weeks if the person has a proper immune system. He can generate immunity against this virus. He can get cured within 2 weeks, or it can range from 3 to 6 weeks depending upon the immunity of the particular affected person. Next one, can antibiotics treat the coronavirus disease? No, it's not going to treat the coronavirus disease. Are masks effective against the coronavirus disease? Yes, masks are very much effective against the coronavirus disease, but wear proper mask. Use N95 mask. Don't use any cotton clothes or somebody using handkerchief. Don't use that. Wear proper N95 mask. It can protect you from the virus. Okay. And who is at risk for coronavirus? WHO has identified two group of people as a vulnerable group of people for this virus. The two group are, one is people above 60 years of age, above 60. Okay, they are more vulnerable to this virus. And the second case is people above 40 who has any disease like diabetes, blood pressure, high blood pressure, heart problem, or lung problem. These people can affected by this virus in a easy way. They are more vulnerable to this virus. So if you have these two group of people in your family, take care of them. Okay. And what is the incubation period of the coronavirus disease? Incubation period means when the time between the exposure and the display of symptoms. For example, if I am getting exposed to this virus, it may take a certain period for me to show the symptoms. Okay, that is known as incubation period. This incubation period can range from 1 to 12.5 days or 1 to 14 days. Okay, that is incubation period. And next one, can cold weather and snow prevent the coronavirus disease? No, it cannot prevent the coronavirus disease. Next one, is there asymptomatic transmission of the coronavirus disease? Yes, there is a chance for asymptomatic transmission. Asymptomatic transmission means if a person gets this virus or gets this disease and he is not showing any symptoms, but still there is a chance for this guy to transmit this disease to another person. Means if I get this disease and I'm not showing any symptoms, but still I can transmit the disease to other person. This is known as asymptomatic transmission. So coronavirus, there is a chance for asymptomatic transmission of this disease. And next one, are there specific medicines to prevent or treat the coronavirus disease? No, up to now there is no disease or there is no medicine to prevent or treat the coronavirus disease. Next one, is temperature screening effective to detect the coronavirus disease? No, it's not that much effective when compared to other test methods like blood test, sputum test, or rapid kit test. This method, temperature screening method, is a least effective method. So don't rely on this method. So if you are traveling, if you are going to any mall, you can see this. They just take your temperature and come to a conclusion that you don't have this disease. So don't rely on this one. Okay. Next one, what is the usual body temperature in coronavirus disease patient? It can ranges from 36 degrees Celsius to 37 degrees Celsius. Okay. How to get tested for coronavirus? I already mentioned how to get tested for coronavirus. Call your local medical team or hospital and get tested through either test like one of the tests such as sputum test, or rapid kit test, or blood test. Okay, so that you can come to a conclusion whether you have this disease or not. So this disease is a very difficult to control. Even WHO is struggling, and most of the countries is struggling how to stop this virus. So the only way to protect ourselves from this disease is personal care. Take care of yourself. Okay, so step 1, wear your mask when you are going out of your home or going traveling somewhere. So avoid traveling. So eliminate something. Okay, avoid traveling, don't go anywhere. If there is no need, avoid traveling. Otherwise, next one, wear mask, wear hand gloves, wash your hands regularly, take some good rest. Okay, because if your immunity system is very important to fight this virus, because there is no medicine. You are the only medicine for yourself. So improve your immunity system. Take good food, take food and fruits that are enriched with vitamin C, so that will boost your immunity system. And take good sleep and rest, and do some exercise, and clean yourself. Keep yourself always clean. And if you feel that you have any of the above symptoms which I mentioned earlier, isolate yourself. That is the best method. Don't transmit to other person. Okay, and some of the people are feeling whether if I have this coronavirus, or I will get a bad image in the public. So what's that bad image? Nothing, because this is just a virus. It's just like a virus or like flu. Everybody can get it. This is not a difficult or a different type of virus. It's a normal virus. But it is very dangerous when compared to other viruses. So don't feel yourself if you get this virus. Okay, if you get this virus, go to the hospital or isolate yourself within your home. Stay in your home. Okay, but if you have the severe symptoms like chest pain, difficulty in breathing, immediately go to hospital. Okay, and thanks for watching. If you like this video, subscribe my channel and share it with your friends, because this is an useful topic, right? And this video is made as per the guidelines of WHO. Okay, thank you.